Hello, hello, hello. Good evening. This is Dr. Muralikrishnan from Los Angeles. How is everyone doing? I know this is a kind of a little bit different kind of live today. And, but am I on? Okay. I think now I'm on. I thought I just lost myself a little bit. Hello, hello, hello. How is everyone doing? This is Dr. Muralikrishnan from Los Angeles, and it is yet another beautiful day here in LA. And I happened to come to LA downtown, and I found a beautiful place to have today's live from this gorgeous place. And I'm really, really, really happy. This morning, I woke up with a very cold weather, and by 10, 11 a.m., it became really warm and nice. By the end of the day, it was so gorgeous, and I have to get to LA. So I thought, okay, I'll just find a nice, good spot to have today's live because I am bringing somebody very special today. So you all probably read about it, and you all probably, were reading and following and knowing about all the details. So I'm very, very happy to, bring today's guest to speak to us. And I'm going to be giving few seconds for all of our guests to join in the meantime, just wanted to make sure how is everyone doing and wherever you are. I know in India the COVID is kind of ridiculous. For the past two weeks, I did, at least last week, at least 1 week, I did not come on live, and since we are still waiting for all the results to be coming in for the Navratri Mandapam Tambura competition, but I got it today. I'm supposed to be releasing it today, so let's see how it goes. But in the meantime, in the meanwhile, this is Who is the Hero show was the one I was talking about for a while. So I thought, okay, I would just bring, since this month is being a very important month for mental health awareness. I thought of bringing a very special guest today to talk about mental health and Alzheimer and, all different, mental health issues, so that, we will be aware of, how to take care of it in case if we happen to, um, have someone whom we know. Who is the hero? Heroes are those who are ready to give his or her life to someone or something bigger than oneself. Right. And this particular show, today is the first episode on Who is the Hero show. And this show will bring in those heroes who, at times, work in silence without expecting any name, any credit, money, or even other normal expectations, and normal expectations, what people usually expect, or those heroes who are involved in an extraordinary work, not many others who are involved in that kind of work, and to bring difference in the society where the world will benefit very big through their work or expertise or knowledge or sacrifices. And today I will be bringing one of those heroes who is working very hard on making a humongous difference in this world to make this world a better place to live for, all of us. May is a month that, it's being a mental health awareness month, as it has been observed in the United States since 1949. It's been a while, right? And the media, local events, and the film screening, and so forth. Everybody will be like appreciating and trying to do something about, the mental health awareness. And So I just decided to bring, through Spring Nectar Foundation, and since we have the Spring Nectar TV, I decided to bring one of those heroes to talk to us on this major subject matter. Mental health. How many of you know that mental illness affect almost 19% of the adult population, and 46% of the teenagers, and almost 13% of the young children each year? People struggling with their mental health, maybe, yeah, in your own family or in your next door, or they may be teaching your children at school, and work with you in the next cubicle, or sit in the same room at a gathering or party or temple or church or mosque where you go, and you name it, and they are all over the place. I mean, with this kind of percentile, it can be anybody and everybody, right? So mental health is a very common occurrence in the human kind. However, only half of those affected receive treatment. That is very sadly the truth, often because of the stigma attached to mental health. Do you know that? So no one knows about it, but even I didn't know about it when I was researching about it for today's episode. I was reading about all that, and I was so devastated to know that only half of them receive the treatment. Untreated mental illness can contribute to higher medical expenses, poor performance at school or work, and fewer employment opportunities, anger, hatred, drug abuse, and increased risk of suicidal, and on and on and on, you can name it. What exactly is mental health? A mental illness is a physical illness of the brain, you know that little mass which is sitting into your skull. That's what I'm talking about. It's a physical, like when you get hurt, how these fingers hurt, or your body hurts. The same way, inside your skull there is a big mass of flesh sitting in there, or whatever, like a organ sitting in there, and that can ache, that can also get hurt. So that causes the disturbances in the thinking, behavior, and energy or emotion that makes it very difficult to cope with the ordinary demands of life. Research is starting to uncover the complicated cause of these diseases, which can include genetics, or maybe brain chemistry, brain structure, experiencing trauma, and or having any other medical condition, such as heart disease and kidney disease. I mean, you can say whatever it can be. So what I came up with, when I was researching, there are two types of common mental health conditions: anxiety disorders, and more than almost 18% of the adults each year struggle with some type of anxiety disorder, including post traumatic stress disorder, PTSD, and obsessive compulsive disorder, and OCD, that we kind of, see it all the time, panic disorder, and generalized anxiety disorder, and phobias, and you name it. And it can be any thing to do with that. So most of the time we get to see that all the time, but we did not know that that is what it is, right? So the second type of mental disorder is mood disorders. And that's what I came to know. Mood disorders, such as a depression, bipolar depression, it affects almost nearly about 10% of the adults each year, and are characterized by difficulties in regulating one's mood. Instead of me talking about it with all these basics, what I know, with the limited knowledge I have, on this subject, I would like to bring the pro to talk to us with more intellectual and scientific evidences and details and research, so that we all can be educated on this subject matter, especially on this very special day, on this very special month of Mental Health Awareness Month. Dr. Manjari Murali. She is a very, very, very special person. I happened to meet her first time a couple of days ago, in face to face, person to person, and I was amazed with the knowledge, and then the subject she shared with me, and it just blown my mind away. And instantly I thought I will bring her in, we will talk to her. And this is, most of the time last year, by this time I started this live sessions. I mean, what I knew was music, dance, and all these art forms. So when all these doctors around the world were working very hard to fight the COVID, how to control or how to cure it, my mind was saying, you all know that I talked in several of my lives, that my mind was saying, hey, you also had the doctorate, with that you cannot do anything, go sing somewhere in a corner. That's what my mind was always saying. I was doing that, but still it was very disturbed, like I couldn't do it. So with my doctorate, what can I do? So that constantly was bugging me, and that was the reason I started creating this legacy of bringing all these musicians, dancers, and the second generation musicians and the third generation musicians, all put them in the live on the platform, worldwide platform, and then give them the opportunity. So that way, you know I decided, okay, keep them all indoors. They were saying, as long as they don't get exposed, they will not be killed with this disease. So with my limited knowledge, what I thought was, okay, don't send them out, give them work after work after work, and have them, if they play music, let them play. If they play violin, let them play. If they play veena, let them play. If they sing, let them sing. So give them work after work after work, and you all know that that created you to be a better person in whatever you have done. So many of you knew that this is what happened. And but now what happened, in after a year, everybody got the idea of what to do with that. Okay, how to go online and how to create your own legacy, and how to sing, how to play. So they don't need me anymore, so you guys know exactly what to do. But with my expertise, there are so many other fields, and so many other like a side of the world needs support. And I wanted to bring the experts from each one of that aspect, and bring them all in the light, and then have them talk to us, so that the world will still benefit, instead of just music and dance and this and that, which what I knew only. So that was the reason. Who is the hero is the title I created. So I'm going to be bringing some top professionals in the field, and some of the people who are working selflessly to make this world a better place to live. I wanted to bring them in, have them talk to us, how they became who they are, in what made them, to become them. So that is what is the idea. And today is the first episode. I just wanted to say a little bit about Dr. Manjari. Dr. Manjari Murali is an assistant professor of health sciences at Chapman University. It's just 20 minutes away from where I live, located in Orange County, California. It's the next neighboring city from Los Angeles. And she is a neuro. I don't want to say the name. I even last time I said that wrongly, so I wanted to make sure to pronounce it correctly. Neurophysiologist by training, and I hope I said it right. When she comes in, I'm going to ask her. She received her PhD from Brown University. That's one of the top universities in the United States, and her Bachelor's of Science degree from Lock Haven University of Pennsylvania. And Dr. Manjari Murali has research and science writing experience in the fields of synaptic plasticity, the physiological mechanism of learning and memory. Think of that. I mean, we only learn and memorize, and how we learn, how we memorize. She studies about it, and that is overwhelming to me to even find out how it could be possible. And then also the Alzheimer's disease, and for her dissertation research, she investigated the effects of acute nicotine administration on synaptic plasticity in the brain reward circuit. And she has authored a book based on her dissertation work, as well as a number of popular science articles on Alzheimer's disease. Dr. Murali has had experience in both clinical and basic science research pertaining to Alzheimer's disease. She is passionate about educating bachelor's and graduate level students who are training to become healthcare professionals. Her current research interests involve around the relationship between chronic stress and Alzheimer's disease risk, as well as the benefits of meditation practice on brain. And she had so much to offer on that subject matter. Actually, when I was talking to her, like a very briefly the other day when I met her, she has been a meditation practitioner herself since 2015. In addition to being a scientist and educator, Dr. Manjari Murali enjoys being a mom of her young daughter. In her free time, she loves traveling and she loves to be around family, read books, and cook all delicacies and go on hikes and, and on and on. She has so many other interests, and that definitely is amazing. She is such an amazing person. Without further ado, I welcome Dr. Manjari Murali on stage. Hello,
Thank
Dr. Manjari
you.
Murali. How are you doing? Beautiful to have you with us today.
Thank you, Dr. Rose Muralikrishnan, for inviting me. I'm honored and humbled by your introduction of me. How
Thank
are you
you.
doing
Thank
today?
you. And you deserve every single word of it. And you are such an amazing person. And I am honored to bring you on stage today to talk to us, to talk to our audience so that, you can share on the world of knowledge that you possess with all of us so that we will be educated on that subject matter.
My pleasure. I look forward to our conversation.
Very, very, very beautiful. I just wanted to find out a little bit about if you wanted to share just a little bit about yourself with your own words instead of my own introduction, please.
Sure. Well, I don't know how much I can add. Yeah, and you mentioned my training. So, just going back to my childhood, I've always been fascinated with the brain, the nervous system.
Mhm.
It was my high school biology teacher that really inspired me to go into life sciences. And when I started college, I was a pre-med major. I wanted to go to med school. But pretty
Oh,
soon in my first year at college, I realized that it was the research, the discovery of treatments and therapies that interested me more. So I wanted to be closer to the bench rather than the bedside. And so I
mhm.
switched gears and I went on to graduate school. And that's how I ended up getting my PhD from Brown University in neurophysiology. And you said that correctly.
Oh, I said it correctly.
You
Okay.
did.
I was a little bit psychology, physiology. I don't want to just blabber it out.
Yes.
Beautiful, beautiful. Wonderful to know that Dr. Manjari Murali. I know Alzheimer's disease is one of your specialties. It is a type of, dementia that affects the memory, right? Thinking
Mhm.
and behavior and all that. Symptoms
Mhm.
eventually grow severe enough to interfere with the patient's daily task, right? And how does synaptic plasticity, which is your research, relate to Alzheimer's disease and area in which you have done so many researches on, and also you have done so many nonprofit work and so forth. If you can share your views on that, that would be wonderful.
Sure. Yeah. And let me start with my experience working in synaptic plasticity. So when in graduate school, I got to study this amazing physiological process known as synaptic plasticity. And as you mentioned earlier, this is the mechanism, the molecular and cellular mechanism by which our brain learns new information. So every time we learn a new skill, or we're forming a memory, where we're maybe going, you're on vacation with your family and you're experiencing new things. Every time you're learning something, your neurons in your brain are firing, right? So neurons fire action potentials, and the signal is transmitted from one neuron to its neighbor via chemical synaptic transmission. So this is essentially the activity of a circuit of neurons. And so the process of learning occurs in the activity, the synaptic transmission between neurons in a circuit. And in the field of synaptic plasticity, we have a saying where we say, use it or lose it, right? And neurons that fire together wire together. So when neurons fire together and they transmit signals to one another in the circuit, they stay active. And so it is in this activity or the physiology of the circuit that the new memory that you formed is stored. So essentially, if you lose a neuron in a circuit, you lose the memory. Even adding a neuron to it at a later point is not going to restore that lost memory. So the unique physiology of the brain makes it difficult for us to find cures for diseases that destroy neurons. So that's synaptic, because that's how synaptic plasticity works. And Alzheimer's disease is a neurodegenerative disease of the brain that essentially destroys neurons. This is a disease, like you said, that first manifests with signs of memory loss, which we call dementia. So dementia is really a group of symptoms that is characterized by loss of memory, changes in behavior, etc. And there are many diseases, brain diseases, that can cause dementia. In about 60% of people with dementia, the underlying cause is Alzheimer's disease. So it is a neurodegenerative disease, meaning that it is going to progressively get worse with time. At the present moment, we do not know what causes Alzheimer's disease. Only about 10% of people with the disease have a genetic link. They have some kind of mutation. Whereas the other 90% of people with Alzheimer's disease, we don't know what causes it. So we call that sporadic. So we don't know if there's a single cause, multiple causes. We don't know yet. And we have no way of arresting the progression of the disease or curing it. So if someone's diagnosed with Alzheimer's disease, unfortunately, they are going to die. And the process is slow. It can take anywhere from 8 to about 20 years after the person's been diagnosed.
Wow.
So, yeah. So
8 to 20 years?
It can, yes, absolutely.
Wow.
And yeah. And I've from my experience working both at the bench, so I've done some research looking at the effects of the heavy metal lead on the peptides, the amyloid beta peptide, which is the peptide found in the plaques in the Alzheimer's brain. So I've looked at the effects of lead on the concentration of the amyloid beta peptide in the brain. And then on the clinical side, I got to intern actually at a clinical trial center where the patients were being treated, or rather they were coming in for research on Alzheimer's disease. So these were patients with Alzheimer's. And then I've also worked in a nonprofit for the Alzheimer's Association. And this is a nonprofit health organization that provides services to both the people with the disease, with Alzheimer's disease, as well as their caregivers. And as you mentioned, this is a progressive disease, and it gets worse with time, and the person becomes completely dependent on their caregiver at some point in the progression of the disease. So, Alzheimer's disease is a caregiver's disease as well.
Wow. Wow.
So, yeah.
Amazing. That's really, it's a wonderful information for us to, know. I mean, I didn't know that, this much of information is, involved in that. And then, of course, the stress response, also known as the fight or flight response, is the emergency reaction system of the body, right? I mean, it is there to keep us safe in all sort of emergencies. And the stress response includes physical and thought responses to our perception of various situations. And then why is stress considered harmful to health, especially on us humans? I mean, it's I still have my doubts on that. It's supposed to be
You,
something better.
you think stress is good, perhaps?
No, it's
No,
no.
no. Well, you're right. So, the stress response is something that we've lived with, and in fact, we should be thankful to our stress response because that's what has helped humans survive as a species since our caveman days, right? So that fight or flight response. If you see, I always use this example with my students. If you see a bear, you have two choices, right? So you can either fight the bear or you flee the scene. So that is essentially, the bear is the stressor, the stimulus that's threatening your survival, and the fight or flight response that your body kicking into high gear is your stress response. And this is essential to our survival, and it has been, since the beginning of our evolution. However, short-term or acute stress is good for the body. So when you're in a fight or flight mode, what's happening is your heart rate is increased. Your body is diverting blood from the extremities, from the skin, for example, towards your heart and lungs. Your rate of respiration increases. You start to break down glucose and fats to release energy. So all of that's good, right? Increased heart rate, increased blood flow, increased rate of breathing, increased rate of metabolism, all great in the short term, right? That's the key here. When, on the other hand, you experience chronic stress or long-term stress, which, is synonym for life these days, right? We're always in high gear. We're always stressed out. When you're always experiencing stress, when you're in a chronic stress mode, that's actually detrimental to multiple organ systems. And these include the nervous system, our cardiovascular system, immune system, as well as our digestive system. And, chronic high levels of stress is going to result, and you can imagine if your blood pressure is always high, you're gonna end up having hypertension, right? And hypertension can result in a variety of cardiovascular diseases. Increased, high levels of stress also affects your immune system negatively. It affects your digestion, and very importantly, and this is what interests me most, is it affects your brain. Yes. Interestingly, high chronic levels of cortisol, which is the stress hormone, when you have high levels of cortisol in the blood for a long period of time, this actually destroys neurons in a region of the brain known as the hippocampus. So the hippocampus is very crucial in learning and memory formation, as well as memory consolidation. So there is that link between chronic stress and learning and memory. Wow. Interestingly, chronic stress also can result in clinical depression. So it has a lot of effects on the brain. And in Alzheimer's disease, which we just discussed earlier, which is a disease of learning and memory, usually what scientists believe today is that although the first signs of memory loss, and it usually starts with short-term memory loss, and then it progresses to long-term memory loss, and then it progresses to loss of the ability to perform daily functions like swallowing and breathing. They forget how to swallow, how to breathe, etc. So that's, as the disease gets to the late stages. But in the early stages of the disease, when the first signs of memory loss start to appear, scientists actually believe that actually occurs about 10 to 20 years after brain damage starts in the brain. So what they're saying is that the subclinical pathophysiological changes in the brain are actually beginning about 2 decades before you even start to see the very first sign of memory loss. So, here's something to think about. What might be happening in my brain in midlife that might be putting me at risk for Alzheimer's disease? Could it be chronic stress? right?
Wow.
And also in the Alzheimer's brain, the first region where you start to see loss of neurons is the hippocampus.
Mm.
And we also know now that chronic high levels of cortisol in the blood damages neurons in the hippocampus. So, there's that, a very plausible link here between chronic stress in midlife and how this might be putting you at a high risk for developing Alzheimer's disease, maybe 20 years down the road.
Wow. Wow. That's
Yeah, and
amazing information.
this
Wow.
is what, sort of made me sort of switch gears a little bit. I'm still interested in Alzheimer's, but now I'm interested in finding solutions to chronic stress. How can we mitigate chronic stress in midlife when, I'm the last thing I'm thinking about right now is Alzheimer's disease, but I don't want to be doing something now that puts me at risk. How can I modify my lifestyle so that I can reduce my risk of potentially getting Alzheimer's disease
Very,
down the
very
road?
Yeah, amazing, amazing. And also, we are fully aware of the fact that stress definitely, causes inflammation in our brain, making the brain more, susceptible to health problems like dementia and stuff. Stress can also lead to other situations such as loneliness, anxiety, and depression. Drug addiction, at times even self-harming. And so many other known or unknown negative risk factors. And I would like to know, and not only me, like our audience would like to know whether there is a link between, stress and Alzheimer's. Are there?
Yeah, yes, and we believe so, and I really do believe that it's the chronic stress that might be occurring in life 20 years or so before you start to develop Alzheimer, or at least you start to see the signs and symptoms. And when you think about it, in midlife, we're always under stress, right? Because this is the time of life when we are, building our careers, raising a family, taking care of aging parents, etc. Right? So lots of competing responsibilities,
Mhm.
right? So no surprise, this is a time in your life when you're going to be experiencing chronic stress.
Very
So,
true.
the way I think of it is, what can we do as a species? How can we, what are some small changes that we can make in our own lives that can reduce our levels of chronic stress? And will this, in fact, reduce risk of Alzheimer's disease? I mean, the research shows that too much cortisol is going to destroy neurons in the hippocampus. Now, could it then, we could then hypothesize that by reducing stress, we would then not damage the neurons in our hippocampus, and perhaps that will reduce the risk of developing Alzheimer's disease.
Wow. Okay. Okay. So now we have to just try to learn to be stress free. And even if we get it, just, don't get stressed out. So that's what people just make sure that I know most of the world consists of a lot of mid-age people than older and younger. So we need to, we need to learn to control ourselves to live, with whichever way possible to live a stress-free life. We have to find a solution to live, I guess. That's one thing, we all have to learn it. And also, I went through your recent bio and learned that you practice meditation. And I'm very curious to know, what drew you to the practice of meditation. Why I'm asking this is because you, as a scientist, scientists personally know what goes on scientifically, in you, in your brain, in your system, in your body and mind when things like this happen. And so without, like doing meditation, this and that, you will know this is what is causing me this, but in spite of all that, I just wanted to know why did you, what really made you, go into meditation, and tell us about how your meditation practice routine and experience and stuff like that with us, if you can share.
Yes. So I actually started, well, growing up in India, most of us learn how to meditate, where, I learned as a teenager, but I never really practiced it until about 7 years ago, almost 7 years ago. And sadly, the reason why I started practicing meditation was because my mom passed away.
Oh, sorry to hear
And
that.
it's,
Very
yeah,
sorry.
thank you. You know, it's just, yeah, I was very close with her, and her passing that was a very difficult time in my life. And so I got back into meditation practice. And this time I wanted to stick with it. And so I practiced every day essentially. And just, before I continue talking about my practice, I just wanted to let you know that today, actually, May 29th, is my mom's birthday. If
Oh,
she
happy
were
birthday,
alive.
Mom. Wherever you are, I
Yes,
know you're
thank
happily sitting there with all the other angels, and definitely you're an angel. You created a beautiful angel as well. And happy birthday to her.
Thank you. I'd like to think that she's watching over me today.
Of course,
If
of course.
she were alive, she would have been 70 years old today.
Oh,
Yeah, so
my.
what started out as a means to help me, overcome this grief, turned out to be much more. So it was really a springboard uh, for much more than that, and it sort of led into my to what my research is today. So as I was practicing this meditation, about 3 months in, I started to notice subjective changes in myself. I noticed that I was able to better regulate my emotions. I wasn't reacting to extremes of emotions. I was able to sort of moderate my response. I was able to calm myself down, reflect upon the situation, and then respond as opposed to react. And I also noticed that when I practice, and I usually practice meditation in the morning, through the rest of the day, I was able to sort of maintain that meditative mood or mode. And then because of that, I was able to focus on the task at hand, and I was able to efficiently get it done. And this was, in the face of, as we are all very much aware, competing priorities, right? We
Right.
always have competing priorities. And it's the stress of all the things that you need to get done, that's part of the chronic stress that we experience, right? So, and I was able to, with the help of my meditation practice, I was able to just sort of stay focused on the task that I was doing, the goal that I was trying to achieve at the moment, complete that, and then move on to the next thing. So I got more efficient, and my stress levels were decreased. So then I thought, okay, if I'm subjectively experiencing this, there's my neuroscientist kicking in. I'm sure there's other people that have noticed this, and maybe some of them were scientists. So then I started reading up the literature, the scientific literature, and lo and behold, yes, neuroscientists have looked at this, and it's a young field of research. But yes, they have found both structural and functional, physiological changes that have occurred with meditation practice, and with as little as 6 to 8 weeks of meditation practice. So, in terms of my regular practice itself, when I first started, I went back to my Vedanta roots, and I would start by chanting 3 ohms. I would sit in a quiet place, and I usually prefer to do it in the morning when the external environment is quiet, people are still asleep, no traffic noises, etc. And I would use an image to help me focus my thoughts on. So the idea with meditation is to minimize your thoughts, right? So that you get to a point where you can basically be aware of awareness itself, right? So thoughtless awareness. And that, of course, is easier said than done. It takes time. And so when I first started out, it was, I would always, I would use an image to help me stay focused. So every time my mind wandered, I would come back to the vision of that image in my mind. And then as I progressed, I was able to move away from that. I was able to focus on my breathing, just, either I would count my breath or just feel the sensation of the air going through my nostrils, through filling my lungs. And then I also, so I go, I use a couple of different anchors. One of the anchors I use today is just focusing on my heart, my chest, just my heart, the pumping of my heart. So these are anchors that I use to sort of to bring my mind back every time it wanders, and it wanders all the time. And those of us who practice meditation, we know this. And so that's sort of how I started. I also complemented this by reading our Vedanta literature, and one of the books that really stuck with me was Viveka Chudamani by Adi Shankara, who is an 8th century saint and philosopher from India. And in this book, Viveka Chudamani, he puts forth 9 values that a person should live by if you want your life to be filled with purpose, if you want to live a complete life. And so I, during my meditation sessions, I started to repeat these 9 values to myself and reflect upon them. So I would think about it. Okay, what can I do today to practice each of these values? So that really helped me sort of bring my thoughts onto this one subject, right? So it helped me reduce the number of thoughts in my mind. And then as I continued my meditation practice. I started in 2015 and I've continued since. And in about 2018, I actually was introduced to a practice called Mindfulness Meditation. And I happened to take a 6-week mindfulness meditation course that's offered by our Fish Interfaith Center at Chapman University. And this opened up more possibilities. So mindfulness meditation, it comes from Buddhist traditions. And the person that secularized this practice of mindfulness meditation was named John Kabat-Zinn. And he actually basically created a program called Mindfulness-Based Stress Reduction, MBSR for short. And he did this when he worked at University of Massachusetts Medical School in Amherst back in the 1970s. And this program has since been widely used in clinical practice, and it's been shown to benefit people with clinical depression, clinical anxiety, and other psychiatric conditions. And this mindfulness meditation practice, MBSR, has also been used widely in neuroscience research. So a lot of the research that's been looking at the benefits of meditation, and they've looked at the benefits of mindfulness-based stress reduction. And John Kabat-Zinn, he defines mindfulness as just being aware of present moment events without judging. So really mindfulness. So mindfulness encompasses a lot of different techniques, and some of those techniques are meditation techniques. And in this, so basically when you're practicing mindfulness meditation, what you're doing is your goal here is to bring all your thoughts to the present moment. So it's all about present moment awareness without judging anything, just observing. So you're not necessarily clearing your mind of thought, but you're bringing your thoughts onto one object or one, maybe a part of your body. You could do a body scan. You could maybe, focus on the pinky of your left hand, for instance. Or you could focus
that actually, like when I started like a while ago, so, one of my yoga teachers was saying, okay, think of something. Okay, so I said, okay, what can I think of? Okay, anything, like even a flower, a cup of coffee or a cup or anything, and even a small rock. And okay, I decided to pick my own name, Rose. And then I was okay, Rose, 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 Rose. I was saying, in my mind, I was constantly saying that. My mind was thinking of everything else except the rose.
Well,
So
I hear you.
I know it is probably a practice over and over. And of course, I did go for 3 months to learn. And again, you did after the 3rd month, I kind of, at least, from the other things, I was able to come back to Rose, even though I was thinking about it, as you mentioned. So it's practice, I guess.
It takes time, it takes patience, and you have to be forgiving of yourself. Don't let that inner critic win, right? Be patient with yourself and just keep at it. And you might ask why, what's the point? Well, the point is there's multiple benefits, health benefits, but the reason I kept going, what drew me to meditation was, after I was able to calm my mind down to a certain extent, I had these moments where I was able to basically have this thoughtless awareness, so to speak, if only for a moment. But in that moment, I felt this immense, immense sense of peace, tranquility, and joy. It's just indescribable. And this was like an addiction. This was the draw. This was what kept me going back. So I looked forward to my meditation sessions every day. And then, as I mentioned, I experienced all those other benefits, right? I was able to be more efficient at my work, pay attention better, regulate my emotions. I was able to practice equanimity, right? Balanced emotions in the face of challenging situations. So all of those benefits. And it helps you reduce stress, right? So I potentially, meditation practice could decrease your risk for Alzheimer's disease.
Beautiful.
So so that's sort of how and then I started incorporating these mindfulness meditation techniques into my practice as well. So I'll talk about that in a little bit.
Like I'm completely aware of the meditation is a habitual process of training your mind to focus and redirect your thoughts. You advocate for regularly practicing meditation. Of course, it reduces stress, controls your anxiety, promotes emotional health. It may even help fight addiction, like a drug addiction and alcoholic addictions and stuff like that. It may help, even improve a better, sleeping habits and on and on and on. And I'm at least from a layman point of view. In your expert opinion, what are the health benefits I'm talking about of meditation? Of course, like with the anxiety, this and that, of course, like with the meditation, it helps. Health means I'm talking about, different, like, chronic, serious health benefits, the meditation has, I just wanted to know, we would like to know, and not only me, like the audience might like to know from your expert point of view.
Well, meditation research, as I mentioned earlier, is still young. This field of research is still young. But from my reading, what I've discovered is that first, neuroscientists started to look at structural or anatomic changes in the brain. So I'm talking about neuroscience research because this is sort of my area. And what they found, and I'm going to quote one study that really stuck with me. And this was a study done by Sarah Lazar and her group out of Harvard Medical School. And this study was done in collaboration with Massachusetts General Hospital. And what they did was they looked at the brain of people who had gone through the MBSR program, the Mindfulness-Based Stress Reduction Program. It was an 8-week program. And they looked at their brain using MRI. And what they found, interestingly, was that there was an increase in the density of both gray matter and white matter in the brain. Now, gray matter corresponds to cell bodies of neurons, and white matter corresponds to myelinated axons. So together, this tells you that there is an increased number of neurons in several brain regions. And the brain regions where they found an increased density in neuronal in neurons is, these are regions that are associated with learning and memory, selective attention, as well as regions that are associated with your self-awareness, sense of self. So awareness of yourself within, as well as visceral awareness of the environment around. So it areas that involved in attention, learning and memory, and awareness had increased numbers of neurons. And then there was again, multiple studies, but one study that stuck with me in terms of the physiological or functional changes. And this was a study that was published by Eric Schwartz and his group, and he's from Boston University. And this study was also done in collaboration with Massachusetts General Hospital, as well as Emory University in Atlanta, Georgia. And what they found, and so in this study, they looked at three groups of people. One group had went through an 8-week mindfulness meditation training, not MBSR. This was, they call this training MAT, Mindful Awareness Training. And then they had a second group that got trained in compassion. So this was a compassion training that was based off of Tibetan Buddhism. And then the control group was an active control group. So this was a group that met every week, and they discussed lifestyle changes that they could make to improve health, etc. And what this study found very interestingly, again, they looked at the brain of people in these three groups using fMRI. And when they were doing fMRI, the people were not meditating. So they were in a non-meditative state. But they asked the subjects to look at images of people. And the images had either a positive valence or negative valence or a neutral valence. And what they found when the subjects were looking at these images and they were measuring their fMRIs, they found that the right amygdala, so the amygdala is the region of the brain that's important is activated when you're experiencing different emotions. So it controls emotions. And they found that the right amygdala was consistently depressed, meaning it was activated to a lesser degree in people who went through the mindful awareness training. Very interesting. The right amygdala had significantly lower levels of activity in the people that trained in meditation. So what this was telling, what they inferred from this was that they were able to practice equanimity. Right. So in the face of extremes of emotions, they were able to stay balanced. So their amygdala was not getting activated too much. And this study, in combination with other studies that I've read, leads me to believe that by decreasing the resources being sent towards the amygdala, the brain is now able to allocate those resources to other regions of the brain. And some other studies show that regions of the brain associated with selective attention, this involves multiple regions, both deep inside the brain, as well as the thalamus, which is in the middle of the brain, as well as the prefrontal cortex and higher brain regions. So by decreasing the activity of the amygdala, those resources are being allocated to other regions of the brain that are necessary and important for selective attention. So the brain is able to better allocate resources. Health benefits by helping you stay equanimous, right, balanced in emotion. You're able to be more productive. Your stress levels decrease because you're not stressing about things. You're not getting overly emotional about things. Instead, you're able to filter, keep distractions at bay and focus on the goal that you have at hand, the task that you need to get done.
Wow, that's amazing. That's really amazing. I understand that you practice a form of meditation called the mindfulness meditation. You said, right? Mindfulness meditation, which focuses on the present moment and living and loving kindness, and and how does this practice, I mean, literally, like work, especially like when you are in a extreme stress. You think that, okay, I'm going to just practice mindfulness meditation, and how does that help reduce the stress? How is it possible even for us to calm down in that kind of extreme stress to practice that kind of specific mindfulness meditation?
Yeah. So as I mentioned earlier, mindfulness meditation and mindfulness techniques in general are aimed at focusing on the present moment events and without judging. Right. So in mindfulness, there are a number of different mindfulness meditation practices. You could do breathing meditation, where you're focusing on your breathing. Body scan meditation. So you scan basically every part of your body and make, try to relax every part of the body. You could do walking meditation and loving kindness meditation, which I'll talk about a little bit more in a minute. And all of these, the goal here, you could do eating meditation, where you might eat a raisin and you just are completely focused on the process of chewing, the taste, the texture, all of that. So again, all of these are techniques to bring your thought to the present moment event, right?
Oh,
And then
okay.
there are
So that
informal ways. Yeah,
yeah.
and there are informal ways of practicing mindfulness as well. For instance, staying focused in the present moment while you're washing the dishes, for instance, instead
Oh,
of letting
yes.
your mind wander, focus on the process of washing dishes. Or when you're driving to work, stay focused on the road, right? We
Oh,
don't always do that,
right.
but so those are all informal ways of
Right.
practicing mindfulness.
Yeah.
And
Just
loving
bring the
kindness.
focus. Yeah. Bring the
Exactly.
focus.
Yeah. And loving kindness meditation is, I have to tell you, one of my favorite types of mindfulness meditation practices. And I've sort of incorporated this into my practice. So at the end of my meditation sessions, what I do is I practice this. And so in loving kindness meditation, what you're doing is you're repeating a set of 4 or 5 phrases. So things like, I wish to be happy. I wish to be safe and protected. I wish to be at ease. I wish to be at peace, right? So things like that. You say
Positive.
that in your mind, you wish that upon yourself and you feel it. And
Mm.
then next, you repeat the same phrases for the people you love. So you say their names and then you say this, I wish for this person to be happy, and so on and so on. And then the third part is the challenging part. So now you wish for the same things on people that make your life difficult, right? We all have those people that challenge us, right, all the time, and they try to, put us down,
Right.
etc. So wish them kindness and compassion. And then
Wow.
finally, you send out those good wishes, of kindness and compassion to all living beings. So in this practice, what you're doing essentially is you're starting with self-compassion, and then you're practicing that same compassion towards others. So
Right.
what I've noticed in my own practice is that this has helped me improve my self-confidence and self-esteem. And in
Definitely.
doing so, it has made me a stronger person, and I am better able to appreciate others.
Right.
As my one of my colleagues recently said to me, a person who has a high self-esteem and self-confidence
Mhm.
is a person who can be supportive of others, right? You can't expect anyone and everyone to be supportive of others. First, you have to be self-confident and have a high self-esteem yourself before you can do that. So,
And only you can do
it's the
it for
same for
others.
others, right? So they have to have high self-esteem and self-confidence before they can support you and be, appreciative of you, etc.
Of
So
course,
those
yeah.
are some of the things that have really come out of this mindfulness meditation practice for me.
Wow, that's
And just to
amazing.
contrast this with Vedanta-based meditation, in our Vedantic traditions, the focus of meditation is trying to achieve that thoughtless awareness, that moment of just awareness of awareness, right? Observe the observer, right? Don't think of thoughts, don't think of an object. The idea is to sort of eliminate all of that.
Right.
Ultimately, your goal is to just be aware of the observer, the witness inside of you, right?
Right.
So that's the sort of a subtle difference between Vedanta-based meditation and mindfulness meditation.
Right.
And
Very
I
true.
tell you, I practice both. They're not conflicting. They both help me in different ways, and I enjoy, I really enjoy incorporating both of these
Very beautiful.
types.
Very beautiful. I mean, I can say it from the way how you present yourself. You're very calm, very quiet, and probably it's due to the practices. You know both types of meditation. You know how to handle anything comes your way. That definitely
Well,
shows on.
thank you for that. But I'm still a work in progress. Much better than I used to be maybe a decade ago. But I'm still working on it. Thank you.
Oh.
Thank you for observing that.
But also, how can meditation training reduce the risk of neurological, disease and help one build the mental resilience?
Yeah, good question. And where this is Mental Health Awareness Month.
Right. Yeah.
Yeah, a lot of people with clinical conditions that many of them not diagnosed, but even just in general, people, everyone today, what with the pandemic has been raging on for a year. It's been hard on all of our
Right.
mental health, right? For every one of us.
Hmm.
Some of us have been affected more than others, unfortunately.
Very true.
But just I just want to say, meditation is a tool that we all have at our disposal.
Hmm.
You don't need any special tools. You can
Right.
start right now. And you can start by practicing for 5 minutes, whatever. You don't have to practice for half an hour, 20 minutes. Start with a 2-minute practice. You don't even have to close your eyes. Yeah, just start. And what, as I mentioned earlier, the both meditation as well as the mindfulness meditation practices have really helped me regulate my emotion.
Hmm.
It's helped me stay focused on things that I need to get done without getting stressed about it. That's the main thing here. Like I used to be a person that was always high strung,
Hmm.
and I've taught myself, I've been able to teach myself to calm down. I mean, there are some moments when I will be stressed, but much fewer and far between now.
Right.
And so reduced stress levels, able to balance my emotions better, stay calm in the face of challenging situations. It helps me really logically think before I act. So I'm not reacting; I'm responding rather than reacting. Also, it's helped me become more self confident, and it's really
Hmm.
helped me build my self esteem. And as I mentioned a couple of minutes ago, that when you practice compassion, self compassion, it helps you build yourself up. Right. So
Right.
it improves your mental resilience. And mental resilience is just that, right? It helps you, it's a process of adapting well in the face of adversity, right? That's what
Exactly.
resilience is.
Very true.
And that's why I would advocate for all of us to practice meditation. It's
Talking
not
of
as
which,
difficult
yeah,
as you
talking
might
of
think.
which. Mhm.
Yes, go ahead.
No, no, no. Talking of which, I remember like we have similar thing in music. I mean, I only know, I mean, anything, every single thing you are talking, I'm comparing myself with, how, even the music itself is a meditation. That's why, in those days, the yogis picked music as a conductor of, of their yogic deeds, I would say, especially the Nada yoga. That's what we call it's. Nada yoga is something, you said like, okay, it can be a small stone, or it can be some edible thing in your tongue, you chew on it, or something flower, like the same like that. Probably, the tone, the sound, nadam means like the music or
Mhm.
whatever. See, the thing is how how it is incorporated is amazing. So the sound and its influence on consciousness have been a matter of great mystery since the early human walked on the face of the earth, I would say. Experienced, examined, studied, and researched by many cultures and civilizations, I would say, for thousands of years. Sound is still the mysterious to many. And then the mystic of India have given some of the answers to the questions, especially when it happens to, the state of health according to the yoga psychology. It's a balanced flow of energy, prana. See, the whole body is consist of lots and lots of nerves. Think of
Mhm.
that. I mean, yeah, the bigger nerves, smaller nerves, and sympathetic nerves, you name it. I mean, you probably know all the scientific name, but all I know is like a strings are running all over the body. And what does on a veena or a tambura or a violin, what does the nerve do? When the nerve is touched with a certain tension, it creates like a certain vibrations. It's same like that. Without us knowing, we have all different size of nerves running all over our body, and then with a certain emotions, each one is pulled out in certain way, and that creates so many different vibrations. And the system is we call it nada yoga. Literally nada means sound, yoga means like a meditation. Like the it's a very, very similar to what you said. Like, okay, pick on a small rock or a stone or a edible, peanuts or whatever that is. Same way, they picked on the tone, I guess. And in the beginning, it is the smallest something. And then once you practice over and over and over, it is a path of exploration of consciousness through sound. That's what it is. The aim of the advanced state of Nada Yoga is to purify and harmonize the gross and subtle fields of the body energy, and bring them in element with their natural vibration. That's what it is. It is the opening of a door on the level of the highest awareness, when a consciousness becomes you know conscious of itself, I would
Absolutely.
say.
I'm very fascinated by this topic, Dr. Rose Muralikrishnan, and we had a discussion about this when we met face to face earlier
A
this
little
week.
bit,
And so
yeah.
it prompted me to research this topic, and very interesting. Basically, Nada Yoga is an ancient Indian philosophical system, and it's
Right.
also practiced as a form of yoga.
Mhm.
And this yoga is based on the premise essentially that the entire cosmos, including human beings, we exist
Exactly.
as part of the cosmos,
Mhm.
are comprised of vibrations, right?
Yep.
And the vibrations are called nada. And that the energy of these vibrations is believed to be the building blocks of the cosmos rather than matter or particles.
Very true.
So it's the energy of the vibrations. And the Indian philosophers, when they put forth this practice of Nada Yoga, what they suggested, what they theorized and practiced was that, by what they believed was that the silent vibrations of the
Right.
self, right, of your own self, your own body within, as well as the vibrations produced by music.
Right.
So where this is where our Indian classical music came into play. A lot of our Indian philosophers and saints, they actually practiced, they preached and practiced through music.
Right.
And what they believed was these vibrations that are produced by ourself within, as well as music, can be considered as a medium that one can use to achieve that unity, as you mentioned,
Right. Exactly.
between both our inner and outer
Culture.
worlds,
Yeah.
outer
Very true.
environment. So very, very fascinating.
Yeah.
And just thinking about this, it seems to me that Nada Yoga and music, Carnatic music specifically,
Very, very, yeah.
the field that you're an expert in, Dr. Murali Krishnan, is another tool that we can use, just like meditation, to build mental resilience.
Very true. Very true. That's what I was going to say. I have so many doctors who are studying under me, like several of the doctors, and then people who work under a lot of stress. They're all my students, and then I always wondered, like, okay, so why they picked music, out of all these other activities? Why, I even asked them several times, and they find it very calming, very soothing. As you said, that okay, that little grape can, the taste of it when you put it in your mouth, that can be a conductor or whatever you call it. The same way that music, when they hear, they don't come and learn to become a professional musician, or they don't come there to create themselves into some legacy of a musician and future musicians and stuff like that. They come to relax themselves. Their stressful work, or in the fast-paced world, they are running constantly, and then they wanted a medium to relax, and they find music to be that medium. All of our experiences of love, joy, peace, health, and happiness are all orchestrated
I,
by
I, I totally
music.
agree with you
Yeah.
about that. I've experienced this myself. Music calms me, and you made that connection between nada and nerves, and I just wanted to sort of allude to that. When you say calming and soothing, that actually occurs when the parasympathetic branch of our autonomic nervous system is activated. So
Right.
just for our lay audience out there, the central nervous system is made up of the brain and the spinal cord, and the peripheral nervous system is made up of all the nerves in our body.
Mhm.
And within the peripheral nervous system, we have several divisions. We have the somatic nervous system, which comprise of all the nerves that innervate all your skeletal muscles. These are the muscles that you have control over, voluntary control over. And then we have a second division of the peripheral nervous system, which we call the autonomic nervous system.
Right.
And to me, autonomic, reminds me of automatic. And so these are all the nerves that are innervating the involuntary organs of your body. So the muscles in your internal organs, the glands of your body, all of which are under involuntary control.
Right.
And within the autonomic nervous system, you have two subdivisions. So you have the sympathetic division and the parasympathetic division. The sympathetic nerves and the parasympathetic, usually they're both innervating all of the same organs. Now, and they also work in antagonism and opposite to each other. So for instance, if you look at the heart, the sympathetic nerves, when the sympathetic nerve stimulates the cardiac muscle, it's going to increase heart rate, right? Because it contracts the cardiac muscle, that increases heart rate.
Right.
Whereas the parasympathetic nerve that innervates the cardiac muscle is going to cause the cardiac muscle to relax, which will then decrease heart rate. So you see how the two divisions, they work in antagonism to each other. And interestingly, the sympathetic division of the autonomic nervous system is the one that's activated during the fight or flight response, that stress response, right? So that's the branch of the autonomic nervous system that speeds your heart rate, that increases your rate of respiration, all of that, everything associated with the stress response. Right. And the parasympathetic division is going to do the opposite. So when you're listening to music, or when you're singing, when those vibrations pass through your body, when you're meditating, similar situation here, your rate of breathing goes down, your heart rate goes down. You're basically, what you're doing is you're activating your parasympathetic nervous system.
Yeah.
So they're linked. Everything's linked. Right?
It's all connected. It's all linked. Exactly. That's what I was going to say. As you said, that the sympathetic nerves, it's all inside. We have our own sounds inside our system. Jokingly in the Tamil movies, they say, "Hey, what is your laptop?" The heartbeat. So we do have that laptop. The sound of it. It does activate all your nervous system, the sympathetic nervous system. So that's the reason, sometimes
we study laptop in physiology as well.
As well.
Yes, absolutely. The same exact sounds. Yes.
So the laptop, it's like we have that, natural sound, natural tone within our system. We don't hear it all the time. The rushing of the blood in our system. The pumping of the heart. We do have the mild, minor noise, happening within us, and that definitely activates also our nervous system, differently, especially the sympathetic nervous system. So that's why they say, people often say, "Hey, don't you get stressed out? You're always happy and smiling and giggly, and I never seen you being stressed out and yelling, shouting, screaming. How is it possible?" So I would say probably musicians are all like that. People often say that I'm so stressed out, my mind is racing, everything seems overwhelming, and I just cannot stop thinking, and our anxious feelings, wearing down the inner spirit, and this and that and all that. How could the music control all this, even without it becomes, the music becomes, whatever said and done, most of our Carnatic music is on some god or other. We are saying constantly a God's name. We are praying indirectly. So the prayer has its own positive vibration in one side. And through the sound you're praying, so the sound has its own positive vibration in other side. And also, as I said, all these tones and nerves on your system, it is literally pulling and pushing all your strings, nerves in your, inside yourself, naturally the calmness. Musicians are not calm most of the time. They are happy. If you notice it, what is the final ultimate idea is, to be the happiest person on earth. They are not calm. They are thinking of, how to be creative, how to do something else using the music. But they will always be fast in their mind. But the thing is, they are happy all the time. They never show there is no negativity.
You don't let the stress get to you, essentially.
Exactly. Yeah. So we know how to, even before, when that comes and hits the musician, they know how to just walk away from it. Just politely excuse yourself from the party, or turn off your computer and just take a break, and find a quiet, peaceful spot,
Mhm.
and just sit and sing just one line
Mhm.
that calms you
Mhm.
down, and that's it. It can be a simple om, or it can be a simple line, or it can be an entire song, or a kirtana, that definitely does the magic
Mhm.
in your system. I mean, I felt it, the music has a similar, especially singing, when you have the instrument, at least it's your idea is implemented on an instrument. But when you do the singing, all your nerves, all your
Mhm.
whole body becomes an instrument. Your whole
Right.
self is becoming
You're
an
using your nervous system, but you're using your pulmonary, your respiratory system, and your
respiratory system.
cardiovascular system. So it's
Exactly.
all in sync. Yeah.
Exactly. So it all
Mhm.
becomes a part of you, and you blow the air, you will pluck the string, and you do all sort of things without telling the world that this is all happening inside you. Same like,
Mhm.
I asked you, okay, that what is happening into that little flesh in your skull, and why do you still have to meditate? Same like that. We will know there's all these things are happening inside. So it's very, the meditation and music, nada yoga, it's all
Well,
very,
when I meditate, as you do when you sing or play the instrument, I'm the subject of my own research. So
there you go. Yeah.
that's just, it's an amazing experience, and I
For
want to
scientists,
share this with
I
everyone.
know, I know. For the scientists, probably, that is the case. Like, okay, first I have to practice. And I mean, you guys will be the guinea pigs of your own. I wanted to practice on my own, and then I will teach the others or other people. That is amazing to know. That's really wonderful. So I am the subject of my own. Then I tell my students, and how wonderful, how wonderful. And but I have one more question. I mean, as I mentioned, it's not easy to hold your thoughts on one object, such as your breathing for
Mhm.
longer than a moment, or a moment or two, because the mind tends to wander all the time, right? Can you recommend some simple steps that one can utilize to start and maintain meditation practice while navigating these challenges?
Yeah, well, sure. Like I said, I want to, I've experienced these subjectively myself, and I want to share with everyone.
Mhm.
I know that there are health benefits because I've looked at the research, and we ourselves at Chapman University. So my academic unit, which is Queen College of Health and Behavioral Sciences, we're starting a new research study in collaboration with our Fish Interfaith Center and Brain Institute, where we are looking at the benefits of our 6-week mindfulness meditation program, which our Fish Interfaith Center offers. And we're looking at the benefits of this, participating in this program, on selective attention, on stress levels, as well as memory. So very exciting times. We're just at the very beginning of this research. So yeah, I really do believe in the benefits of meditation. And in addition to all the health benefits that I mentioned earlier, emotion regulation, improved selective attention, equanimity, all of that. In addition to that, through the practice of meditation, by developing the ability of reducing the number of thoughts, what you are able to do then is then focus on the present moment. And now you might ask, why is that important, right? So it's all at the why. What's the benefit to me? The benefit is, when you're able to focus on the present moment, of course, your stress levels are decreased, and your mental agitations are decreased. So by focusing on the present moment and getting the current task, the current goal accomplished without worrying about the past or the future. Remember, our mind is almost never in the present moment. We're always either in the past, uh, you know, um, complaining about our past, or being anxious about our future. But by being in the present moment, what happens is you become really good at what you do, and the product of your work is exemplary. Believe it or not, it does happen. And by doing that, you're going to be very satisfied with the result of your work. Remember, you're the only person that can control what you do, right? You're not in control of what others do. But by being in control of your own thoughts, words, and actions, by staying focused in the present moment, you produce a product that is really exemplary. And you will be satisfied with the results, with the outcome. And because of that, when the present becomes the past, you no longer have qualms about the past because you know you did your best at that point in time, right? So that was the best outcome possible. So now you no longer worry about your past or have qualms about your past. Right. And you don't worry about the future because you know when the future becomes the present, you're going to be doing your best. And you know that in the moment, by living in the present moment, you are laying a strong foundation for your future, right? Because your actions in the present are going to yield results in the future. So you see so many benefits from meditation.
Right, right.
So even though it's hard to start, I would encourage you to start. And what I would say in terms of, to the novice practitioners, the first thing I would say is, quieten your external environment, right? So find a quiet, clean, peaceful, calm place in your home or wherever you practice. Do it at a time of day when there are lower noises. Yes, go ahead.
That conflicts with my other yoga now. I'm just joking.
No, not necessarily, right? No, not.
I'm just joking.
Yeah. So maybe beginning of the day or end of the day when external noises are lower, and you could start with a practice that's maybe 2 minutes, 5 minutes. It doesn't have to be long, right. And make sure that your environment is clean so you have less distractions, right? You always have this one spot that you go to for meditation, no distractions. And then just sit there, even if you don't close your eyes, sit there and just clear your mind of thought. Find an anchor that you can use. It could be an image, it could be a chant, it could be a part of your body, it could be your breathing. Find that anchor that always helps you, right? Anytime your mind starts to wander, bring it back to that anchor. As one of my meditation teachers would say, it's like you being at a train station, right? So don't get on the train. Just watch the trains come and leave the train station, but you remain behind at the train station. So you're the witness or the observer, right? So if you get on that train, you're basically going away, wandering off with the thought, right? As opposed to staying present. So just keep at it. It will get easier with time. I can tell you from personal experience, it gets better. Just practice as many days of the week as you can. And it gets better with time. And then in time, you will notice reduced thought, and you'll be able to better regulate your emotions. You'll notice it. You'll notice the changes in yourself. Just keep at it. Lots of benefits, lots of health benefits. It helps you build your own self-esteem and self-confidence. And then you can help others. You build your mental resilience through the practice of meditation, and you can use that to help others build their mental
Beautifully said, beautifully put together. Thank you so much for letting us know that, Dr. Manjari Murali. I personally wanted to thank you for an enlightening and entertaining conversation during this Mental Health Month, covering your extensive research work on Alzheimer's, of course, with the stress and how meditation improves, mental resilience and so forth. We really, really appreciate having this mysterious area clarified in a detailed manner. I mean, nobody else can, give this much of information to us, especially during this month. Your advice to our audience, of course, and around the world is very informative and, of course, especially very, very, very useful. The audience may not know this, Dr. Manjari Murali, but I owe you a very special thanks for being here, because I happen to know personally that you had a very busy schedule of finals exams week at the university, and you still could make time for us. And this is really amazing. We really appreciate that. And please accept our sincere, sincere thanks. And thank you so much. Thanks a lot for this beautiful session, Dr. Manjari.
Thank you, Dr. Rose Muralikrishnan. You're too kind. Thank you for having me, and it's my pleasure. And thank you for giving me this opportunity to share this information with our audience, with your audience. I hope it helps as many people as it has helped me.
Of
Thank you
course,
so
of
much. And
course.
I,
Even
and
though
I've
they
learned
were,
a lot from you too,
thank you,
especially
thank
about
you.
hatha yoga. Thank
Thank
you.
you. This is really beautiful. I really appreciate, and thank you so much for being here with us. Like I just wanted to talk to the audience. A little bit. Although the general perception of mental illness has improved over the past decades, studies show that stigma against mental illness is still powerful, largely due to media stereotypes and the lack of education, and that people tend to attach negative stigmas to mental health conditions at a far higher rate than to other diseases and disabilities such as cancer, diabetes, and heart disease. Stigma affects not only the number, seeking treatment, but also the number of resources available for proper treatment. Stigma and misinformation can feel like overwhelming obstacles for someone who is struggling with a mental health condition. Especially this being a mental health month, here's a few powerful things you can, our audience can do to help, showing individual respect and acceptance. If you know that somebody is, suffering from um, mental health, and then advocating within our circles of influence, do something, influence them, and learning more about mental health. Research it. I mean, at least to me, I only researched after I came to know about Dr. Manjari Murali's background, and after I spoke to her, I researched about mental health, and I learned a lot about it. And then sometimes, when we come to know, in our day-to-day life, you go to a shopping, you go to a place, two people will be conflicting on some subject to each other, fighting, and we thought, oh my god, okay, let's just get out of there. So rather, from now on, I would say that, hey, is there any kind of support and help? I mean, I don't want to barge into their personal lives and then say, hey, why are you fighting? But is there any situation to calm them down? They might be going through something within themselves, and we might not know. So don't, as she said, don't judge anyone, because it doesn't really help. And that's a wonderful word or a sentence. I took it from her: do not judge. They might be in a different situation, they might be in a different phenomenon, or whatever it is happening in their system. And do not judge anyone if something is not according to your wishes, that you wanted them to be seen. Like, that's what I would say. Thank you again for all our great, wonderful audience for being with us for this long, to hear all our, beautiful Dr. Manjari Murali's speech and expertise and knowledge she shared with us. And again, Dr. Manjari Murali, thank you again so much. And I'm looking forward to, I hope that you can be our host in one of our, channels. And I don't know whether you know about, I have recently started, it was my 30-year-old dream, which came true like last month. Spring Nectar is taken another step to become a Spring Nectar TV now. I'm bringing lots and lots of beautiful programs, and this subject is one of the subjects. If you would love to bring it to our audience, in a weekly basis, we would love to have you. Think about it. Just put thought.
Absolutely. Yes, we'll talk. And thank you for launching this new TV channel. And congratulations and all the best. And
Thank
I
you.
also want to thank your audience. Thank you for being patient and listening. And have a
Sure.
great rest of your weekend.
Thank you. Thank you. Thank you. And love you all. I will see you again with the yet another program and with the yet another hero very soon. And today's hero is Dr. Manjari Murali, and we had a phenomenal session with her. Thank you all. Love you all. And I'll see you all soon. Bye now.